Hello, you're welcome back to our YouTube channel. This is the Gives. This is actually a continuation of the first part of the video concerning bleeding in pregnancy that we've just looked into. We are now concentrating on the bleeding that occur, let's say from mid-pregnancy, from second trimester to third trimester. That's what we're trying to consider now. What are the kind of bleedings that might occur, that might take place? We've seen that happens especially in the beginning of the first trimester in pregnancy. So what are the ones we're going to look into? Let's see 5 other kinds of bleeding still that might happen in the course of pregnancy. The first is threatened abortion. Threatened abortion might occur midway in pregnancy. Usually to about 20 weeks of pregnancy, you can experience that kind of situation. What might cause or what might lead to threatened abortion? It can be trauma to the abdomen, it can be infection, it can be something kind of medication which is not good for a pregnant woman. These are the things that might lead to threatened abortion. And one will ask the question, what do you do in this case? First of all, if you have such kind of bleeding, please note it's not severe. I mean, it's not so much in volume, that's what I meant, as in the case of your usual menstrual flow. The fetus is still viable and the cervical arch will be closed in this case. What are the measures? What are the lines of action? When you go to see your doctor and you do an ultrasonography examination and the fetus is well and thriving well, the next thing is for you to have bed rest. You have to have some rest. Maybe it occurred because of stress, and you need to reduce the kind of workload you give on yourself. At most, you'll be given a medication, progesterone, for example. So it depends on the severity, and the earlier a measure is taken, the better it will be and the better outcome for both the mother and the fetus. So the next we're going to look into is placenta previa. So what is it? It's a case where the placenta is lying low towards the cervical arch. So in this kind of case, it poses a threat. Also, it might cause bleeding, and either towards the end of pregnancy or even towards the time of labor, it can happen because the placenta is lying low. There are different kind of grades, there are different kind of classification, but we're not going into that. So that's a kind of bleeding one can also see. And what are the possible risk factor or things that might expose one to such? One is former placenta previa for someone that has been pregnant before, you had such situation. 2, if it's a twin pregnancy. 3, if you had cesarean section before now. So these are the possible things that can be a risk factor for placenta previa. The next is placenta abruption. So this is when the placenta detaches from the uterine wall where it was attached. This can be partial, it can be complete. For placenta abruption, you might or might not notice bleeding, depending. There could be bleeding, but some bleeding will not flow out. Some bleeding will flow out, while some will form hematoma. So it depends on the site and where the bleeding is coming from. So there could be placenta abruption, but the bleeding might not really show. I mean, the blood might not flow out. In some cases, it will flow out. It's quite a serious situation. And what you notice in this kind of situation is abdominal tenderness. 2, you could notice reduced fetal movement. So that is why for a pregnant woman, you have to pay attention to everything that happens to you. The changes in your body is very, very important for yourself and for the well-being of the unborn child. And it will also help to give a correct information to the medical doctor. The next is placenta accreta. This is when the placenta grows deep into the uterine wall. And in this kind of situation, this kind of bleeding usually will occur after delivery. I will explain. So for this kind of situation, after delivery, you expect the placenta to be delivered just a few minutes afterwards. But in placenta accreta, that doesn't happen. Why? Because the placenta is deep inside the uterine wall. So this is one of the major causes of postpartum hemorrhage. Why? Because the placenta grows deep into the uterine wall. Also, there are risk factors that could expose one to this kind of situation, just like the situation we mentioned earlier. Previous cesarean section, if you had postpartum hemorrhage before, for multiple pregnancy, these are risk factors to placenta accreta. But there are other forms also, increta and pacreta, but that's just not what we are going into now. But it means that the placenta goes deep into the uterine wall, and of course, it will, in such situation, there will be increased bleeding as opposed to none. So the last one we're going to see is Vasa previa. This is a situation where there is rupture in one of the blood vessels supplying the baby. So remember that the mother nourishes the fetus through the placenta, and the umbilical cord usually attached to the center of the placenta. So in this situation, the blood vessel lies closer to the cervical arch, and once there is rupture of the membrane, which will eventually cause rupture of the blood vessel, which in turn leads to bleeding, and which is a threat to the life of the baby. So this is one of the kind of bleeding that happen in late pregnancy. I would say this is a kind of bleeding that happens during delivery. So it's very, very important to for one to pay very close attention to this kind of changes and this situation. That's why thorough investigation is very, very important for a pregnant woman. I believe that this explanation, this enlightenment about the kinds of bleeding that happens in pregnancy, are being of great help. So you know when to worry and when not to worry. There are things not to worry about, and there are things that are sort of concern for you to take measures, to avoid disaster. That's why these things are coming your way. So know the ones that are dangerous, know the ones that need you to stay put and stay calm. When you see spotting early in pregnancy, so you know it's not to worry about, that it's just implantation that is taking place. After you found out that you are pregnant and you are sure. And the next thing, if you see early in pregnancy after sexual intercourse, you went for pap smear and you simply know that this is nothing to worry about. But rather, when there is infection and when there's ectopic pregnancy, it becomes a source of concern. Also, when you notice bleeding, maybe midway in the course of the pregnancy, somewhere before the 20th week, and you notice that there's no fetal movement as it used to be, there's abdominal tenderness, and you notice bleeding, and you went for ultrasonography and fetal well-being is fine. So of course, we are talking about the case of threatened abortion. You should have some rest and avoid stress during the course of the pregnancy. And the rest, which we've mentioned, that happens usually towards time of delivery, you should pay attention. Ultrasound will show and reveal the position of the placenta, so you will know if you're at risk of placenta previa or placenta abruption. So all these things is for your well-being, and I believe you've learned one or two. If you have, please do well to subscribe, do well to like, do well to share, and turn on the notification bell so you get notified next time when we upload a video. Thank you. We're glad to have you. Bye bye.